Parkinson's is a progressive degenerative disease, and the first time I was told that, it was like a slap in the face.
Hi, Suzanne. How are you?
But Suzanne Tidingfong is fighting back thanks to a powerful right hook.
And I found that I have a hard right. I can hit with my right.
And the care provided by the UW Medicine Neurosciences Institute. Suzanne was diagnosed in 2010. She didn't have tremors that some patients with Parkinson's or essential tremors experience, but she did have other symptoms, including pain, which she was able to control with medication. But after 5 years, the medication stopped working. It's hard to believe it when you see her boxing, but she says any movement was painful.
The major problem that I was having was the dystonia, which was the cramping in my legs and my foot. And I could not go anywhere. At night, it would be, after the medications wore off, it would be so bad that I would be crying. Previously, I had gone on with this motto for Parkinson's that I had Parkinson's, but Parkinson's did not have me. At that point, I had come to the conclusion that Parkinson's totally had me. I could not imagine going on that way.
Put your elbows out like this, nice and strong for me.
At certain points, we get to a stage where the patient is no longer responsive to our powerful, symptomatically improving medications.
Good job. And then we'll put your palms in your lap like this, back and forth as quickly as you can.
And at that point, UW Medicine Neurosciences Institute comes to the rescue. Neurosurgeons are trained to work with neurologists to evaluate these patients and to select a small number of them that are great candidates for something that sounds very unusual but is a tremendously helpful strategy, which we call deep brain stimulation.
One of the neurosurgeons at the UW Medicine Neurosciences Institute, Dr. Andrew Koh, performed the procedure on Suzanne, implanting an electrode in her brain while she was asleep.
What surgery can offer is a way to alleviate some of those symptoms. We can often reduce medications that patients have to take, but the goal of treatment is to restore functionality, so to improve their motor function, to have them be less disabled by their symptoms, and improve their quality of life.
It basically runs a test from the generator up to the electrode and back down.
Suzanne sees nurse practitioner Courtney Weaver for regular follow-up visits. In addition to monitoring Suzanne's condition, Weaver also checks the patient programmer. It's about the size of a remote control, and it allows Suzanne to deliver the deep brain stimulation, or DBS for short.
As the medication starts to wear down, because I have issues with the medication wearing off before I can take another dose, as it starts to wear down, then I will increase my DBS so that it compensates for that and it keeps a good balance to help manage my symptoms.
She's definitely somebody who has really embraced the autonomy that you can have with deep brain stimulation.
Nice job.
And that has really helped her feel like she's owning her own care.
With the pain under control, Suzanne took up boxing.
They told me that it helps with the progression of the disease and it helps lessen your symptoms. And I didn't believe it. You know, I just thought, okay, sure, I enjoy it, I'm going to do it, but I don't really think I'm going to have that dramatic of effect. The next day, my symptoms were so much reduced. Just like that. DBS has given me a new lease on life. It's a gift.